Technically, there's two nares. In your nasal cavities, what's in between them. So your nares is the opening from the atmosphere to your nose, and then the opening from your nose to your throat. External nares and internal nares. But these are just your nares, right here, your nares. Because your list doesn't differentiate external and internal nares. So that's your nares. And then this is your nasal cavity. What's next?
Nasal conky.
Okay, these three turbinates are called your nasal conchae. You have your superior, middle, and inferior nasal conchae. Now, you have grooves underneath each one. And those grooves are called meatuses. So what you have is this. You have a superior, this is a superior nasal conchae, middle nasal conchae, inferior nasal conchae. This is a superior meatus, middle meatus, inferior meatus. What it does is, air goes across these conchae, turns from laminar flow to turbulent flow, increases the amount of surface area of the air that can be moisturized and cleaned by your nasal cavity, because now it's swirling around, and you clean the air. So these conchae change laminar flow to turbulent flow, and you clean more of the air. And these are the meatuses, superior, middle, and inferior meatus. So conchae, and the grooves underneath them are meatuses. What's next?
Hard palate and soft palate.
Okay, your hard palate has this maxilla and palatine bone overriding it. That's your hard palate. Your soft palate is right here. Your soft palate doesn't have a bone over top of it. It's right here. Hanging off your soft palate is your uvula, the punching bag in the back of your throat. So this is soft palate, this is uvula, this is hard palate. What's next?
Oral cavity.
Okay, your oral cavity is your mouth cavity, your buccal cavity, your mouth cavity. This is your oral cavity right here. Your tongue's right here. Next.
Pharyngeal tonsil.
Okay, you have three tonsils. You have a lingual tonsil right here. You have a pharyngeal tonsil right here. And I don't like how it's showing it, but there's a K on it. And you have a palatine tonsil right there. Let me show you a better model of those tonsils. By the way, the heads on these torsos have these tonsils. This guy has a good one. Don't confuse this with the sublingual salivary glands and the submandibular. Don't confuse that, all right? Here's your pharyngeal tonsil, right here. Here's your palatine tonsil, right near the soft palate, palatine tonsil. All right? And this right here is your lingual tonsil, right here, right in the back of the tongue. So pharyngeal tonsil, right here, palatine tonsil, and lingual tonsil. Questions? Okay. What's next?
Pharynx.
Okay, your throat or your pharynx right here is divided into three areas. You have your nasopharynx right here. Nasopharynx. It's the part of your throat closest to your nose, called the nasopharynx. You have your oropharynx right here. It's right behind the tongue. And you have your laryngopharynx right here, closest to the larynx. Laryngopharynx, oropharynx, nasopharynx. There's not a hard and fast line. Like I can't show you a line that separates them. But if I put A, B, C and say name those three parts of the pharynx, you're going to have to say nasopharynx, oropharynx, laryngopharynx. All right? What's next?
The opening of the auditory tube.
Right. The opening of the auditory tube is right here. I'm just looking to see what other models I have up here. Ha. Yeah. This probably has a better one. Right here. This is the opening of the auditory tube right here. Your eustachian tube opens right there. It's also right here. But that, to me, that looks stupid. So I like this one better, right here. That's your eustachian tube opening. What's next?
Larynx.
Larynx. The larynx is where your vocal cords are, right here. Your larynx is right here where your vocal cords are.
Epiglottis.
Okay, this is your epiglottis. It's the piece of tissue that when you swallow food, bends down and closes your larynx, and then the food goes down your esophagus. It's something pretty cool. Babies have more of an umbrella epiglottis. It's more like an umbrella than it is a doorway. So we have like, our epiglottis goes like this, and then the food runs down our esophagus. We close off our larynx completely. Babies kind of go like this. They just put an umbrella over it. They don't really close it off. This is why babies can nurse, breastfeed, and breathe at the same time, if you ever noticed a baby doing that. Because there's milk's running down their esophagus, and they can get air around the umbrella. It's kind of cool that babies can do that. Okay, what's next?
Glottis.
The glottis is the hole between the vocal cords. So the best model I have to show you the glottis is that right there. I got it. See that hole? So I'm pulling on a string and opening the hole. I'll say name that hole and you'll say glottis. Right here. That's the glottis. By the way, what I'm pulling open is the vocal cords. By the way, this is the epiglottis on this model. See, it just goes like that and closes off. So next.
Hyoid.
Okay, the hyoid bone is right here. This is that floating bone. Hyoid bone.
Thyroid cartilage.
This is your thyroid cartilage. Your Adam's apple is right here. So this is your thyroid cartilage, and that's your Adam's apple.
Cricoid cartilage.
This is your cricoid cartilage right below the thyroid cartilage. Be very, very careful. Watch. See how the thyroid cartilage is big and fat here, and the cricoid cartilage is thinner? Watch what happens when I turn around. When I turn around, my cricoid cartilage is big and fat, and my thyroid cartilage is thin. Careful where I ask you. Make sure you look at both sides of this model. Thyroid cartilage. This is still thyroid cartilage. This is still thyroid cartilage. This is cricoid. Still cricoid over here.
Is that the anterior?
This is the anterior. This is the front. Yeah. Cricoid and thyroid. What's next?
Arytenoid.
Arytenoid cartilage. These two cartilages right here are arytenoid cartilages, and on top of them, these pinpoints of the top of the arytenoid cartilage are called corniculate cartilages. These are corniculate.
You already showed us the vocal cords, so trachea.
This is your trachea. Everyone knows the trachea. Yep.
Carina.
Okay, now, on your trachea, take the heart off. This is the model you need to go to now. So this is your trachea. This is your trachea. Right here, where your trachea splits into the primary bronchi, this is your carina. This is your carina right here, where the trachea splits into right and left bronchi. Go ahead.
And there's the primary bronchi.
Okay, here's what happens to your bronchi. Singular bronchus, plural bronchi. You have a left primary bronchus. You have a right primary bronchus. Those primary bronchi, left and right primary bronchi, go to the right and left lung. Okay? But then these primary bronchi bifurcate. They bifurcate into secondary bronchi. They're also called lobar bronchi because one of them serves one lobe of the lung and the other one serves the other lobe of the lung. But the left lung only has 2 lobes and the right lung has 3 lobes. So I better have 2 secondary lobar bronchi in my left lung, and I do. And I better have 3 secondary or lobar bronchi in my right lung, and I do.
Tertiary bronchi.
Okay, then my secondary or lobar bronchi bifurcate into my tertiary bronchi right here, and these go to a segment. The segments are named, but I don't name them for you. So if you're going to medical school or PA school or something like that, you probably should look up the names of these segments. They have names. These tertiary bronchi are also called bronchopulmonary segments because these tertiary bronchi are segmental bronchi. They go to a specific bronchopulmonary segment. So these are called tertiary bronchi. They're also called segmental bronchi or bronchopulmonary segments. I keep saying that because it's on your online quiz. Bronchopulmonary segments. What's next?
Bronchioles.
And then the bronchioles aren't shown here. How am I going to show you guys bronchioles?
down there.
Yeah, right here. Thank you. And then the bronchioles, they stop having cartilage. They have more smooth muscle and less cartilage. The very tips of all of these are bronchioles. You're going to look at this and you're going to say, Kiggins, they still have cartilage. Well, they continue to have some cartilage, but they're not as... The bronchioles have less cartilage, more smooth muscle. Because it's the bronchioles that you constrict and dilate. These big things with all these cartilaginous rings don't constrict and dilate as much. But way down here in the bronchioles, there's more smooth muscle, less cartilage, you constrict and dilate them. Next.
Lungs.
And then you have your left lung and your right lung.
And then it goes into your superior, middle, and inferior lobe.
Your right lung has a superior, middle, and inferior lobe. Your left lung only has a superior and inferior lobe because the left lung has 2 lobes and your right lung has 3. 1, 2, 3. 1, 2.
Cardiac notch.
Okay, there's a notch in your lung on the left side only. It's right here. This is the cardiac notch. What fits into the cardiac notch? Your heart. You notice that the right lung doesn't have that notch. Doesn't have the notch. The left lung has that notch.
Hello?
Okay, you guys didn't do 204 yet. These indentations into the lungs right here, where the blood vessels go in and out and the bronchi go in, these indentations right here are called a hilum, or together both hilums are called a hilus. It's just an indentation in the organ. On the kidneys we have a renal hilus as well, so next semester you'll learn a renal hilus. It's just the indentation in the organ which receives in, where things go in and things come out. It's just the indentation. In fact, I'll probably say name the indentation if I want you to say hilus. So this indentation right here and this indentation right here is the hilus.
Muscles.
Receives the blood vessels.
Say again?
It receives the blood
Receives the pulmonary arteries and lets the pulmonary veins run out of it and receives the bronchi. And then the muscles you already know. You go over to a model and you have to do the scalenes, the intercostals, the diaphragm, probably the pec minor. Pec minor on there?
Yes.
Did I miss one?
Sternum.
Rectus abdominis, your stomach muscle. Probably sternocleidomastoid. Do I need to point those out? You guys already learned them. Okay, so you got to know those muscles again. Guess why? They are breathing muscles. Your diaphragm is your primary breathing muscle, but you can also raise your rib cage. And those other muscles raise your rib cage and lower your rib cage for active exhalation. Is that it? Okay, let me show you what you need to do on your pig and get it open today.